and treat. With that, over to Dr. Walensky. Dr. Walensky?
Thank you, Jeff. Good morning, everyone. I'd like to start by walking you through today's data. The current 7-day daily average of cases is about 692,400 cases per day, a decrease of about 6% over the previous week. The 7-day average of hospital admissions is about 19,800 per day, a decrease of about 8% over the prior week. And the 7-day average daily deaths are about 2,200 per day, which is an increase of about 21% over the previous week. Yesterday, CDC released a new report that details the severity of Omicron in comparison to other variants. Similar to our prior report, these data demonstrate that COVID-19 disease severity appears to be lower with the Omicron variant than with prior variants. On this slide, you can see relative rates of cases, shown in purple, hospital admissions, shown in orange, and COVID-19 related deaths, shown in blue. This figure compares these outcomes during the 3 periods of high COVID-19 transmission. The peak last winter is shown in the green shaded section, when vaccination rates were low and cases, hospitalizations, and deaths were high. The peak during the summer months was when the Delta variant was dominant, is in yellow shaded area, when nearly 50% of the country had been vaccinated with a primary series. And the third shaded section in orange represents the past month, when cases dramatically increased due to the Omicron variant. Right now, nearly 64% of the country has received a primary series, and about 50% of eligible people over 18 are boosted. When you look at the Delta period and last winter, as cases increased, hospitalizations and deaths increased in a similar pattern. Strikingly, when we compare the past month, when Omicron was the predominant variant, we see a clear separation between cases, hospital admissions, and deaths. And while cases have dramatically increased and are 5 times higher than they were during the Delta wave, hospitalizations have not increased at the same rate, and deaths remain low in comparison to the case counts. When looking across these 3 periods, though, of high transmission in the pandemic, you can see that while the number of hospitalizations is higher now than we have ever previously seen, the ratio of hospitalizations to cases remains lower than prior peaks. When we look at other disease severity indicators measured among people who are hospitalized with COVID-19, such as hospital length of stay, ICU admissions, and deaths, these indicators are lower with Omicron than during previous periods of high transmission. And this is likely attributable to 2 key factors. First, many people in our country have some level of immunity from vaccination and boosters or from previous infection. And second, it's likely that Omicron is less severe than prior variants. Although it's encouraging that Omicron appears to be causing less severe disease, it's important to remember that we are still facing a high overall burden of disease. Hospitalizations have rapidly increased in a short amount of time, putting a strain on many local health systems. Importantly, milder does not mean mild, and we cannot look past the strain on our health systems and substantial number of deaths, nearly 2,200 a day, as a result of the extremely transmissible Omicron variant. Please remember the importance of our prevention measures, including vaccination and boosters. Last week, I highlighted 3 publications that described the effectiveness of booster doses in protecting against the Omicron variant. It is of critical importance that people remain up to date on CDC's recommended COVID-19 vaccinations. It's vital that we all remain vigilant in the face of this virus. I know many people are tired, but many of our hospitals are still struggling beyond capacity. It's been a long 2 years. However, please now do your part to lean into this current moment. Now is the time to do what we know works: wear a mask, get vaccinated, and get boosted. Thank you. I'll now turn it over to Dr. Fauci.